Hi, my name is Ariana Pera, and I'm going to talk about health informatics and the battle against drug addiction. So, what are some mental health consequences of drug use, and what are some general consequences of drug use? So, with mental health, drugs can affect the overall mental well being, things like psychological factors. For example, paranoia, irritability, and anxiety are all common side effects of drug use. Some consequences that follows are people failing drug tests during jobs, or it can lead to health risk factors like high blood pressure. These can really jeopardize your health overall, and we know that health is wellness. So not only is it affecting you mentally, it's affecting your overall life. So, the concept of a game theory model basically explains dependency. Econ tutorials explain that it is a study of rational decision-making situations where the outcome of one patient choices depends on the decisions made by another participant. So how does this relate to drugs? We can look at the cat and mouse theory for this. The mouse would be people who want drugs. They don't want to be caught due to illegality, so they strategize prevention of being caught, such as smuggling drugs, hiding drugs, things of that sort. Now, the cat would be law enforcement. The cat is trying to stop the people from spreading drugs overall. And then you have the cheese sellers, which are basically people who sell drugs. Yes, so these three main concepts is like a model, and they all depend on each other. In a way, if one is behaving a certain way, then the other also has to behave a certain way. So one actions of a participant will determine the other's actions of another participant. So what is the opioid risk stratification tool? The opioid risk stratification tool is a general assessment that physicians use to safely medicate patients. It determines the risk factor of someone taking a medication, and if so, the doctor would not prescribe them the medication. So they will ask questions like family history of substance abuse, alcohol, illegal drugs, prescription drugs. They do this in a way that to make sure that the patient isn't being prescribed anything that can potentially harm them. So this is basically a safety assessment. It's something that is needed. So what is the ML algorithm? An ML algorithm is short for machine learning. This machine is designed to identify patterns in training data and apply pattern recognition to make accurate predictions on new data, according to www.ibm.com. It is a form of artificial intelligence which makes it easier to collect data that humans may miss. But how can they predict drug use disorder patterns? Well, the core idea is to understand that they don't diagnose, but rather help healthcare professionals see risk. That being said, they can pull large amounts of data in terms of pattern recognition, like medical records or prescription patterns and such. This type of information can tell the activity of how recent or often a patient have received medications or prescriptions. That way they know if something is being abused or not. And if not, they can ask questions like, okay, what's going on in the past month or the past week? It sees that you've been in and throughout ERs in these hospitals getting prescription, like what's going on. So how can you advocate for people suffering with drug addiction as a healthcare professional? The main thing you want to do is make sure you are educated enough on how to care for a person who's struggling with drug addiction. For example, in most cases, in drug addiction, you see a lot of overdoses. So knowing how to care for a person who's going through an overdose is very important. For example, learning how to use a Narcan is advocating for people suffering with drug addiction. That way you're saving their life. Learning how to care for them during but learning how to care for them during your overdose is very important. Make sure they're not laying on their back. Make sure they're laying on their side. That way they're not choking on vomit. Doing anything that can really save their life. So what are some risk factors that can lead to drug addiction? Well, there are plenty. For one, being male. According to maplesrehab.com, substance abuse is statistically more prevalent among men due to societal pressure and physiological factors. The idea that men are able to express themselves gives rise to abusing substances as a coping mechanism. Depression is one, family history, PTSD, substance abuse, hyperactivity, or inadequate parental supervision. If someone isn't being supervised at a young age, they can get exposed to substances that they're not supposed to be exposed to, and they can become addicted. Thank you guys for watching my presentation. I hope you guys learned something about health informatics on drug abuse.